The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
It's the Becky and Boca Show, coming to you live every Thursday night at 6 p.m. from glamorous downtown Boca Raton. I'll show you how to live life in style in one of the country's most elegant cities, nestled right along the beautiful Atlantic beaches between Palm Beach and Miami. So sit back, relax, and let me show you how to indulge yourself Boca style. Hello, welcome to the Becky and Boca Show. And I am pretty excited about tonight's show because this is a lot of information that I'm interested in. And what we're going to be talking about is there are people all over the place in Boca Raton and this area that are injecting themselves daily with one of these two drugs, Semorelin or Ipamorelin. And these are not human growth hormone. And they're not anything that I knew about. But I do know a couple of really great-looking people that are in so much better shape than everybody else, although they're the same age as everybody else. And I finally found out that they were doing this, so I thought I have to do a story on this. I need to know how it works. And it must be pretty good if people are willing to inject themselves daily with it, although the doctor now tells me you don't have to inject yourself. So today I have Dr. Cecilia Lacayo. She's an MD from BioStation. And after the break, we're going to bring on a patient, Tanya Marquez, who is on this regimen, and she's going to tell us her experiences. So I think this is like a big secret that a lot of people have been keeping from me, because once I talk to them about it, they tell me it's the fountain of youth. They say it helps them lose fat, build lean muscle, get better sleep, have more energy, all sorts of wonderful things. And I've done a lot of Googling about this, and all this stuff seems to be true. And I've also read that it's not a dangerous drug. So I'm going to talk to the doctor now, and she's going to tell us all about it. Hey. So, hi, Dr. Lacayo.
Hi.
So you're at
Becky.
the BioStation in Delray, right?
Correct.
Okay, they have one in Miami too?
Yes.
Okay.
Being that it's been abused for a long time, the government stepped in and started regulating the use of growth hormone. It was
abused because people were buying it on the streets, right? They weren't
They
getting
were buying on the street. They were buying it from unknown sources. They were injecting without direction, without knowledge. They were overstimulating their body into producing the wrong things, and they end up with destroying their body instead of, they had a short benefit period, and then they destroyed their body. So it became illegal or a controlled substance.
Which means that only a doctor can prescribe
Only
it.
a doctor can prescribe, and the doctor has to be specifically trained for this and this and that. So a lot of doctors backed off, and it was sort of lost growth hormone. But it still remained the drug of choice for children who are not growing.
Okay.
So children are getting growth hormone, and they're not developing any significant serious diseases as they grow older from the growth hormone.
Because it's monitored by a physician.
And it's monitored and it's done right.
Okay.
So around 2005, more or less, they discovered this amino acid peptides.
That's the two drugs I was talking about. Okay.
This combination that stimulates the secretion of growth hormone from your pituitary gland, mimicking the same as growth hormone. So it stimulates the production, or they also mimic the production.
Oh, really?
Yes. So the two of them, it happens at night, and it happens like a pulsation. When you're young, you secrete growth hormone, rapid, and lots of intense production of it. And then it stops during the day. As you get older, it slows down. The production is less. So you have adult growth hormone deficiency. Or insufficiency, which means you are not deficient, but you're insufficient enough that you're starting to feel it. More fat, less muscle, less energy, impaired sleep.
Right. And you work out really hard and don't build any muscle.
And you work hard. Absolutely. We all have those moments. What's going on
here? I'm spending a lot of time at the gym and nothing's happening.
And a little pot belly and a little this and a little that. So over the years, they have been discovering more and more combinations of amino acids that work good at stimulating growth hormone.
Now, let me ask you, is that safer than just taking human growth hormone? Is it safer to stimulate it with these peptides?
Good question. It is a lot safer because if you stimulate sufficient growth hormone for optimal health, then it will not stimulate more growth hormone.
Yeah, I read it's almost impossible to overdo it with
you
these
don't
drugs.
Overdose,
It's
you don't
not
overdo
even possible.
it.
Yeah.
And you still get the benefits.
Right. Oh, these people I
leaner-
know, I'm not naming who you are, that weren't telling me, they really, they look really good. And they have energy, and, they can move like no aches and pains.
Skin.
Yes. Tightens the skin too, right?
Helps tighten the skin because as your growth hormone goes low, not deficient, you start getting wrinkle. So that helps if you have any facial procedures, Botox, fillers. You enhance the effect and the benefits by taking those peptides that stimulate the secretion of your growth hormone.
Wow. Okay, so how do you take it? Most people are injecting it that I know, but you said you don't have to inject it.
You don't
correct?
have to.
Okay.
We use compounding pharmacists who are able to put it in a little trochee that you suck at night. 5 minutes, it's done. It's in your system before you go to sleep, and it starts working.
Is it better to inject it than to take it that way?
It's not that it's better, either or is your preference and your fear of needles.
A lot of people told me they were afraid of needles. Nobody in Boca Raton because we've all done Botox and fillers. But people from other areas have contacted me when I was promoting this, saying they're afraid of needles.
But the needles are not big.
I know. I saw one. Little teensy
They're
weensy.
like diabetic insulin needles.
Yeah, little tiny
So
needles.
it's
And
not
where
even
do
a
you do
mosquito.
the injection?
The injections are usually recommended in the lower part of the in the abdomen, below the umbilical cord, the umbilical opening.
Okay.
And because that area is the less sensitive area.
You wouldn't feel it.
And you
Okay.
always rotate the sites.
Okay. Now, I know someone that's on this regimen with the injectables, and she told me when she travels, it's very difficult because you have to keep it cold. You can't jostle it, that kind of thing.
Absolutely. That's the beauty of the trochees.
Yeah, that's
the
what I was
oral
thinking. Why would
ones.
anybody do it
Well, you can
injectably?
have the injectable at home if you like it. Some people have that preference. And the oral one when you travel.
Why would anyone prefer injectable over oral?
It's a preference.
Okay, so it makes no difference which one you...
No
Oh,
difference.
I know some
The
people that are going to be
formulates-
traveling a lot easier now after
But
watching this show.
Some people feel better with the injectable than the oral troche.
Is there a reason?
No reason.
Okay.
It gets absorbed in your mouth
Okay.
where you have greater absorption.
Okay, so that's good. All you people afraid of needles, you don't have to worry
Yes.
about needles now. People on this, and I've done a lot of reading on it too, say that it's life transforming to go on this regimen.
Absolutely. It is not a Tylenol that in 6 hours you don't have a headache.
Yeah, I was going to ask
That's
you,
a
how long
given.
does it take?
Everybody's different. How much damage do you have in your body? Did you smoke? Did you drink? Is your exposure to environmental toxins high, like plastics? We were
She's
talking
telling me
about
you don't
it.
want to drink out of styrofoam or plastic.
Things, just to give you an example. Number 2, are you deficient of other hormones or insufficient?
So do you do blood work to find this out?
We do blood work, absolutely. We also do saliva test, urine test, whatever is needed.
So if someone wanted to go on this regimen and they came to the biostation, the first thing you would do is test all their levels, correct?
We do blood work, yes.
Okay.
We do more extensive blood work than conventional medicine. Why? Because we're not reacting to a disease that presents in front of me to treat. I am being proactive, digging into your blood and looking for imbalances, insufficiencies before they turn into a disease so we can be proactive and prevent
So
them.
this could prevent diseases?
Yes.
What kind of diseases?
Mainly chronic diseases that develop over the years from hormonal imbalances, hormonal deficiencies, or insufficiencies. As you notice, the most common hormone deficiency that happens overnight, basically within a year, is menopause. And we see how our body changes. We go from shopping at the petite stores to the big stores because our bodies change.
Right.
We're gaining weight. We're
So
getting
going
arthritis.
on these drugs will help us lose weight and get
They're
back a
amino
more youthful
acids.
body?
Mm-hmm.
Wow. Okay.
We also look at your thyroid. We look at your insulin levels. And we look at them when you eat. Because when you eat is when you start creating problems.
Okay.
We don't live our life fasting to check your fasting.
Right.
We like to look at them. Are you creating disease with the foods you're eating?
Oh, interesting.
So we provide a very comprehensive plan, optimizing your amino acids, your peptides, your hormones, but also improving your nutrition, helping your body detoxify from environmental toxins.
So a person would feel a lot better after getting on this regimen.
Absolutely.
Correct?
Absolutely.
Wow. Someone wanted me to ask you, how women that have had cancer, like breast cancer, they can't take hormones, but can they take this?
It's a good question.
Okay.
Hormones and breast cancer, it's a very complicated subject because you have what is called estrogen receptors, progesterone receptors in the breast that had been stimulated 2 to 10 years prior to the cancer showing.
Okay.
Okay? So, way before you gave anything to that person, way before you gave them a peptide.
Right.
So, in my opinion, that's a very personalized question that would require our evaluation of their hormonal system, the type of cancer they have, what stages they were at when they removed it,
Okay.
how many years has it been since they removed it. So all of that will help me and the other doctors at the biostation find out and figure out what that person can take and what she can't take.
Okay, so it is possible then that they could take these drugs.
It is possible,
Okay.
absolutely.
Okay, and you would monitor them to make sure that it wasn't
Absolutely.
doing any
That's
damage.
the beauty, we monitor.
Okay.
We don't just
So
tell
how
you.
often does if someone wants to start doing this, they come first for blood tests, panels, and then you would prescribe these drugs if they're a candidate. Then how often do they have to come back and repeat the blood tests?
Excellent question. When the patient comes in, before they come in, they get the blood test, that comprehensive blood test. We do a 1 to 1.5 hour assessment, physical, history, since they were the time where they were
That's good for
born.
anybody to do. Yeah.
History. We put together the imbalances that we find in the labs with the symptoms, and based on that, and with whatever the patient is complaining and physical findings, history, etc. And then we create a protocol for them. Protocols are based on hormonal imbalances, vitamin deficiencies, detoxification, gut health,
Okay.
brain health too. And the protocol gets started. Everybody starts at their own pace.
Okay.
I start with this, with that, with everything, For hormones, initially we give them a 1 to 2 month time of saturation with the hormone in
Okay.
the cells.
Okay.
For us to look at the blood, look at the urine, look at the saliva, whatever we need to look at. And at that time, we readjust the treatment based on the response.
Based on what? Okay.
We don't leave you on a treatment forever.
Yeah, just go on this and go away. Okay.
We will readjust the dose.
Because you want to make sure that it's working properly.
Everybody absorbs different. All cells go dormant. The receptors for hormones, they shut down. So is it 50%, 80%? Everybody's different.
Right.
So at the rate of absorption, we monitor.
So are there different dosages for these? Because I was reading that some people will do, if they're on Semorelin, for example, some people will do it like 20 days in a row and then be off for 10 days. Have you heard of that?
Some people do that. There's no need for doing that because, like I say, it does not overstimulate
Right.
the
Yeah, I read that.
pituitary to produce growth hormone.
Okay.
And the dose varies mostly on the size of the patient, on the symptoms of the
Oh, I
patient.
see. Okay. Okay.
So there's no overdosing.
Okay. Someone also wanted me to ask about age. What age person would be most likely to start this? Is it for young people, or is it for people middle age? Is it for older people?
Good question. You would not believe how many hormonal imbalances and deficiencies and insufficiencies I am seeing patients in their 20s and late teens.
Oh, really?
Yes. Well, think of one. PMS, bending over with pain, migraines, etc., when you're 13, 14 years old. So all of this stressors, foods that we're eating now, loaded with starchy carbs, with sugar, bad fats, environmental toxins that children are exposed to, all of that's modulating their hormones, anywhere from the thyroid to vitamin D to sex hormones to growth hormone. So now they're growing, but now they need their growth hormone to repair, regenerate, continue to have energy, mental acuity, so they can do good in college.
Right.
So
you can even
in
help,
high school.
Wow.
So
even young people.
as needed, you can use it.
Okay.
Plus, you can use it for the benefits of weight loss.
Well, that's what I was going to ask you about. That's what most people are interested in.
And
does this help us lose weight?
Yes, and we have weight issues at early age nowadays.
Absolutely.
So it's individualized. Again, they require a well-trained physician.
Yeah.
We're well-trained. We're specialized in integrated holistic medicine. We have certificates in advanced training in anti-aging, regenerate the body, integrative medicine. So functional, how the cells work to get sick and not get sick. So we know how to do it. We are also staying on top of cutting-edge technology in medicine, which keeps evolving.
Keeps changing. Absolutely.
To prevent or reduce your chances of getting chronic diseases. And that's what the biostation is. That's why it's different. We are different. We are doing it, we're progressing, and we are highly trained.
Okay, let me ask you this. On the other end of the spectrum, somebody today that's in their 70s asked me if they had never been on any kind of hormone replacement, could they start this now, this Semorelin?
Absolutely.
Yeah, and it would help them too.
Absolutely.
Wow. Okay.
Yes, remember, with artificial hormones or artificial hormones in combination with bioidentical hormones, the risk for complications is high. Clots, strokes, heart attacks.
That's if you're taking hormone
synthetic
replacement. Right.
Bioidentical
but that's
hormones.
not what this is, the Semorelin.
No.
Okay.
So everybody was trained to think you only take hormones for the
short period of
immediate perimenopausal period, and that's it.
So you could stay on these indefinitely?
Yes.
And they're safe?
Yes.
And you did tell me that they even help the heart muscle.
Yes.
Wow.
So,
okay.
What happens is once you go on bioidentical hormones, you're replacing what you lost to a good level, not an abnormally high level. So you're improving the quality of your life. So we're not replacing growth hormone, but we're giving you the peptides needed to stimulate your own.
So you're growing. Okay. So can
like
someone just do the Semorelin without any other hormone replacements?
You could, but
okay.
Weight gain can happen from low progesterone, low testosterone, low estrogen.
I do know a couple of people that are doing this in addition to, I think it's testosterone cream. How does that work?
So they're replacing also the hormone testosterone that they're deficient on. And that hormone can go down. Young men in their 20s, young women after the first pregnancy.
Okay, now I talked to a couple of people that told me women, they did the testosterone and they started having side effects like growing hair and undesirable places, things like that. Would that happen?
Excellent question. And you know why? Because everybody thinks that if you take testosterone, you're going to grow hairs. I'm going to give you an example. My grandmother said to me when I was very young, if I go to the hospital, I want you to pluck my hairs. I don't want the doctors to see my mustache or my chin. Did somebody give her testosterone? No. She was deficient on progesterone and estrogen, which are your female hormones. You lose that, you start looking...
You start to grow hair.
An older man and an older woman that start looking like each other.
Well, I have heard that women start to look like men when they get older if they don't do some sort of replacement. That's the scary thing.
See what I'm talking about?
Yeah.
Now, when you're giving or taking testosterone and you're not measuring to keep those levels optimal within the normal range, you are going to have excess testosterone, which is not a side effect. It's what we call iatrogenic. Somebody induced this without monitoring you.
Right.
And without adjusting the dose.
So that wouldn't happen if you were being checked regularly at BioStation.
So we highly recommend they come back for their monitoring with levels to adjust the
medication. And about how often did you say a person would come?
In the beginning, we do 1 month, 2 months, or 3 months, depending on what they're taking. Mm-hmm. Sometimes we go up to 6 months or once a year if they're perfectly stable.
Everything's going good.
Rarely we let them go once a year because stressors in life can change everything.
Okay, can we talk about price? Is this cost prohibitive for most people or is it affordable?
Good point, because everybody has a point of prohibited.
Yeah.
You know, somebody prohibited is Neiman Marcus, not to mention somebody.
Yeah. We are in East Boca Raton.
But somebody is prohibited, even Walmart. So
yeah,
prohibited is different, and I have experienced it myself.
Mm-hmm.
I know that from my days of medical school, at the beginning of the month when that check arrived from my dad, I was rich for 2 weeks. I know at the end of the month, I was dirt poor.
Right.
Okay? So it all depends, and it all depends on what your needs are.
Can you give me an idea of what it would cost to be on Semorelin, for example?
Semorelin, we're looking at, I don't get into prices.
Because they don't buy it from you, right? They buy it from a pharmacy?
Exactly. It's a compounded product, so it's not, I don't focus on the price so much as on the medical aspect of it. But in our office, they can help them with that, definitely. They can help them figure out. And like I said, you have a person that values a cruise. Another person values a Louis Vuitton.
I'd probably put this way before.
Another
you look a lot
person
better on your cruise if you're taking this.
A Louboutin shoe, and the other one so a price is relevant to how much you have to spend.
Well, I heard someone told me it's a couple $100 a month for the Semorelin.
Probably.
Okay.
Yes.
Okay. And to a lot of people, that's affordable. To some people, it might not be. But if you're talking about feeling a lot better, and I know, yeah, I'm sure you are.
That's why we had to do this after work.
Well, I don't know who wouldn't want this.
Because people value taking something and seeing results.
Right.
Not taking something that a year from now they have to take something for the side effects.
So how long would it take to see results? How long would it take to see the weight loss and
everybody's different. Again, we go to, are you coming from 300 pounds, from 200 pounds, from 50 pounds, from just a little pouch? Are you in menopause? Are you before menopause? Do you exercise? Do you eat right?
I was going to ask you about that.
So we just don't, see, you can go to a vitamin shop and get an oral substitute of a peptide that helps stimulate growth hormone.
It's not the real thing.
Who knows who made it?
Yeah, be careful, people.
But they're not doing and advising you on all the other things you need to do to make sure that works and it's not being thrown away.
Right.
What you eat, how to walk, how to exercise, how to defervesce your stress, etc.
Okay, everybody I know that's on this is also a big gym rat and they work out and everything. Does it work equally well for a sedentary person?
Not necessarily. Again, we go.
You got to get a little closer.
No, not necessarily. Okay. You need to be active.
You need to be active.
So at the BioStation, we don't sell you things. We provide you the service, the teaching, the training of complete wellness, nutrition advice. We coach you. We stay on top of you. Did you take it? Are you doing okay? How can we help you? What do you need help with? Because we know you can go to China and order some Semorelin
And a lot
or
of people do. A lot of
Ipamorelin.
people are looking for a shortcut. They'll
But
go online and try to order this.
It's not going to work if
Right.
you don't have the medical professional
counseling.
support system for all the things that need for everything that you're doing to work well.
Right. I think this just sounds amazing. We're going to go to break here in a minute, but I wanted to ask you, I read that it helps with aches and pains that we get when we're a little bit older. We go to the gym and we're sore for like 3 days.
Absolutely. Improves the recovery.
Yeah, I read that too.
And
I had
we were talking about nursing homes.
Yes.
Recovery. It could take 3 months to recover from a fractured hip,
Mm-hmm.
or it could take in a week. You are on crutches or in a wheelchair back to work because you have optimal growth hormone levels and not suboptimal.
Wow.
So that's a good example.
Yeah.
Okay, you can
Yeah.
relate to that, right?
Sure. Absolutely.
So a young
any age
person with optimal growth hormone breaks an ankle, they're back in school Monday.
Mm-hmm.
An older person breaks an ankle with low or suboptimal growth hormone, and it will take weeks and weeks in rehab and pain and inflammation. When I talk about muscle strength, I also talk about ligament strength that supports every joint in your spine, your neck.
And this improves that.
Absolutely.
Oh, wow. Okay, we're going to go to break here, and then we're going to bring a patient on, Tanya. She's going to come on next, and she's on this regimen. She's going to tell us her experiences. So this will be fun. You've been listening to and watching The Becky and Boca Show. Hello. Welcome back to the second half of The Becky and Boca Show. And I'm here with Dr. Cecilia Lacayo. She's an MD from the Biostation. And a patient from the Biostation has joined us. We're talking about these drugs, Semorelin and Ipamorelin, which stimulate your body to make more growth hormone. And Tanya here has been on this regimen for about how long?
About over a year now.
Over a year? Okay, move a little closer to the mic.
Over a year now.
And
yes.
why did you go to the Biostation in the first place? What were your symptoms?
Well, I had a hysterectomy when I was about 46.
Okay.
So I was left with just one ovary, and I was feeling fine.
Okay.
Then about a few years after that, my menopause started really kicking in, and the hot flashes, and you get moody and tired, and everything hurts, and my skin got like seaweed.
Oh,
And
wow.
I wasn't even 50 yet, and I'm like, oh my God, I'm just aging so rapidly
quickly.
and not feeling well. I did visit a few different doctors. They all did the blood test, and they're actually telling me I was crazy. They put me on like Adderall and Xanax to wake
Wow.
up and to go to sleep.
Oh my gosh.
Instead of getting in, I obviously got worse. Then, like most people probably will gain weight from all of this, but I went the opposite direction. I actually lost a lot of weight to a point that I was like half my size now. I couldn't eat.
Were you moody, depressed, or anything like that?
Depressed because I wasn't sleeping properly and I had to be at work early, and I do hair, so that doesn't work well.
Right.
And so somebody one of my clients actually was going to the Biostation, and she was telling me
Told
how
you about it.
fabulous she felt, and she had a lot of my symptoms. And I literally, when I finished doing her hair, I went and called and made my appointment, and they saw me right away. And it was great because they did all my blood, and
Yeah, like the doctor was talking about. Okay.
yes, and they were able to tell me what was wrong with me, and then I was able to see that I wasn't, all in my mind. They say you get into that fine line, like you're getting older, maybe she's going
Right,
crazy.
Okay, so what did they prescribe for you?
They prescribe, besides the Semorelin, I'm on the pellets,
Okay.
and I'm on a medication since 7 keto.
And
I think
doctor, what
I'm
is-
saying it right?
Yes,
What is in the
Okay.
pellets?
Pellets. First of all,
Pellets are the best.
Wow, this is like
it's
Pellets is
I'm
an
so
all-
excited.
I want to bow. Thank you so much. You have
how
saved
happy
my
she is.
life. You really have.
See, I was reading that people
I
say it's
can.
life changing.
See this? You saved my life.
You saved my life.
That's the reason I went into this new specialty, and I dropped conventional medicine, And I went into learning about how to give the body what it needs to repair itself, to feel better, to optimize your health. I went through it.
Okay.
And when I went through it, I was crashing. I use the word crashing.
Really?
Yes,
Okay.
I was
crashing.
able to read, but I couldn't understand what I was reading.
Oh, that
I'm
bad.
intelligent.
Yeah.
I went to medical
I
school.
can see that.
I got an MBA in medical management. I've done extensive, everything to me has
So
been a
you,
board
like her,
certification.
was trying to figure
I
out what was
crashed.
going on.
I thought, it's retirement time. I'm going into a nursing home with Alzheimer's.
So you could turn that all around. Are
Yes.
you on Semorelin?
Yes.
You taking Semorelin? Okay. Wow. And now I want to point out again, that's not human growth hormone. You're not taking the hormone. You're just stimulating it. It's a peptide that stimulates it in your brain
The
to
production.
produce the proper amount. And I read that there's no danger of overdosing. It can't produce too much.
Correct.
So it's a safe drug
It is safe.
and healthy for your body, correct?
And helps your body stay healthy.
And
and
feel
improve.
better.
And feel better and look better.
I know. I have seen some of the Semorelin abdomens, I'm going to call them, with, the no fat. And
Yes.
I just find this incredible. I go to a gym every day. I work out really, really hard. We had to do 100 burpees in a row the other day, and I couldn't keep up with, I'm in there with a bunch of 20-year-olds. I couldn't keep up with them. And I was like, I had to stop
what
and
you
rest. I
just
felt
said?
like I was 100 years old.
20-year-olds.
Maybe I shouldn't be working out with 20-year-olds.
No, but I'm talking about optimal hormone
Right.
level.
That's when they, right.
And suboptimal.
Right.
And you're not deficient yet. You see the
Yeah.
difference?
Yeah. No, I see what you're
You
saying.
have symptoms. You're not crazy. You have symptoms.
Right.
Okay.
And this could all be treated with a drug like Semorelin or Ipamorelin. Now, that's just a newer generation of that drug? Is that what that is? Okay.
It's a newer generation. And
Okay.
you know what? Science keeps evolving. Mm-hmm. So they keep finding more.
Better and better.
And more specific for weight loss, more specific for libido. To enhance erection in men.
Oh, so the men and women
Peptides.
can take this. Okay.
We have peptides that a little tiny injection under the belly, and a man that hasn't had erections in years can have an erection.
Wow. That's
Isn't
amazing.
that gold?
Yeah, you're right. Yeah.
And they don't have to, it's quality of life changing. Their self-esteem goes up.
Well, sure.
They have positivity
Absolutely.
instead of depression.
Right. Wow. I got a whole bunch of questions here for you two because people have been contacting me all week. I read that it even helps your hair.
Yes.
Is that true? Did you
Yes.
experience that? You have beautiful hair.
Thank
so-
you. But it made my hair thicker, from
Oh,
stress,
boy.
from being sick. Your hair, you lose your hair more than you should. My muscles. The moment I started, I would say probably my second round of the Semorelin, because my body was very low on. I was down to nothing on my hormones, so they had to rejuvenate my whole body. And I would say on my second round of the Semorelin is when I finally started to see muscle tone and tightening of
That
the
must be
skin.
exciting.
It's fabulous because
Tightens the skin.
I hadn't worked out in 2.5 years prior to going to the station. I couldn't.
Now you had the energy.
I couldn't.
So
Then
I could
started
maybe do those 100 burpees in a row?
Yes,
If I was-
then you get the energy to work out and you just feel alive
feel
and,
better.
and just so much
you
better.
feel young, right?
I have an advocate with the biostation, so if you have any questions, anything that worries you, all you have to do is
You call them up and
I
they-
text Elise, and she's always there for me. It's just so nice to have a whole medical team really behind you and they're watching everything you do. They
And I
make
like the fact that it's medicine too, because a lot of people try to order these things online. They try to do it at a health food store. They try to do it themselves. I don't know why.
how do
Maybe
you
they're afraid of
know?
doctors.
You have to take a blood test.
Well, they don't. I
Otherwise,
guess they
you
just
don't-
guess.
How do you
Yeah.
know? You can't do
Yeah.
that.
Yeah.
Right.
It's bad.
Yeah.
Very bad to do
So
that.
that's what makes the biostation unique. The fact that we provide this service, training, teaching, because you need to learn about what works in your body, how your body works, so you
Sure.
can help us take care of you. What to eat, what not to eat, how to inject. Simple as how to inject.
Do
What
you inject it?
Yes.
Yeah. And you prefer that to to taking it orally?
Yeah.
Okay.
It's just easier for me.
It's easier.
Yeah.
Okay.
See,
Maybe
everybody's
next time.
preference
I guess,
is different.
Were you
I don't
afraid of
mind at
needles
all.
before?
No, not really.
No, okay.
And they're so tiny.
I know. I saw one. People that are afraid of needles, it's not
and
really.
you can't. You barely feel it.
Yeah.
Barely feel it. So it's just.
And
know,
you do one injection a day?
I actually do it every other night.
Oh, every other night. Wow.
Look
Yeah,
at
I have a small. I'm only 15 milligrams, something.
She's
very
getting to the
small.
point where every other night works good.
Yeah.
And what about when you travel? Is it hard for you
I
to
take
take
it with me.
Do you have to keep it refrigerated?
Yeah.
Okay.
But I've never had any issues. I have a little pouch.
Someone
that
told
I
me you
bought.
can't move it around a lot. You can't jostle it. Is that? Have you ever
Well,
heard that?
yeah, I carry it with me in my purse, and it's just standing and with a cube of ice. And
Okay. What time of day do you inject it?
I do it at night, right before I go to bed.
I heard it helps you sleep too.
It's wonderful.
Wow.
More Xanax for me to sleep. It's just
Can you
fantastic.
imagine? She was on Adderall and Xanax.
Oh my gosh.
One to wake up and one to sleep.
So now you're off of all those.
yes.
And this is all you need. And it's a healthier, much healthier alternative.
They also give me vitamins that I should be taking, like what am I? Oh, I forgot. Sorry, but they also
you-
put you on vitamin supplements that go with
But what you're lacking.
with
okay.
what you're lacking, and they really
Wow.
they work. What is it? Dim is one of them.
Dim, absolutely.
Absolutely,
What is that?
fantastic.
These are plant-based products, extracts, proven, documented, scientifically studied, that they help deviate estrogens from the bad path, carcinogenic, to the benign. We were talking about styrofoam and plastic.
Yeah, let's tell my people about that real quick because I didn't know that.
Styrofoam and plastics can mimic
Like water bottles.
estrogen
And
turn your estrogen
Styrofoam cups?
carcinogenic.
so you don't want to drink out of these.
You don't.
It
You
can
don't want
cause-
to
what
cook
does
with
it do?
them. You don't want to heat them up. They're in the category of xenoestrogens, Xeno, xenoestrogens.
So you can ingest estrogens from drinking out of plastic?
The plastic seeps the chemicals into the water you drink. And those convert your estrogens into carcinogenic.
So you mean like for breast cancer or something like that?
Yes, ma'am.
So that could be caused by.
Yes.
Oh boy.
Breast cancer is linked to genetics, environmental toxins, and that's what plastics are.
Okay. So the best way to drink your tap water is out of the tap, right? Or water is.
You
to
don't
drink.
drink tap water. You drink filtered water.
So you filter the water in your own home. You
filter
don't
the
buy
water
it in
your
plastic
home,
or.
put it in a glass container. Keep 2 bottles in the car, one at work, wherever you go. Carry them with you. Protect yourself.
Right. Oh, I had no
so
idea.
DIM, let's go back to
Okay.
DIM, has science behind it to help block the carcinogenic path, reduce it significantly as you stop introducing. So it reduces your chances of any estrogen in your body of converting into carcinogenic together with other things we do, like antioxidants.
Okay, so let's say someone that had breast cancer, they have to stay away from estrogens. So they could be getting a problem from drinking out of plastic or.
If somebody with breast cancer was told to stay away from estrogen, that includes xenoestrogens, which is environmental toxins, and most conventional medicine teams don't tell you that. Mm-hmm. But those are the ones that led you to the wrong path.
Right.
And carcinogenic, increases your potential.
Right.
There's other mechanisms, but
Right.
we're talking about one
One of
right
them.
now in
Right.
specific.
The one that you can
it's
control.
easy to control
Right.
at home.
Sure. So why not? Wow. Are you on testosterone?
Yes.
In addition to you take Semorelin and
Semorelin, and I believe the testosterone is in the pellets, correct?
Correct.
oh, okay, okay. And what does the testosterone do for a woman?
Excellent. Everybody thinks that testosterone is just for men. Mm-hmm. We learned that since we're kids, right? Both men and women have exactly the same hormones. The difference
not know
is
that.
the difference is dominant testosterone high levels in men, dominant estrogen in women, but we have testosterone.
You have both. Okay.
So our testosterone is considered one of the fertility hormones because it increases your libido.
Okay.
Then you want to have sex, reproduce. Every time you reproduce and have a baby, testosterone levels drop. That's nature.
Okay.
So you reach the point of no libido, no sex, stop reproducing, menopause. That's our genes. But together with losing your testosterone, a lot of things happen to you. You start developing weight gain, more fat, less muscle.
That's why it's so much
what?
harder to lose weight when you get
More
older.
wrinkles. Your face starts to droop. And because we don't know it's probably related to testosterone, we run for a filler, for Botox, which is good. It's fantastic because you want to look good.
Right.
You want to feel youthful. But we can help you be youthful in the inside by restoring your hormones. So I'm going
And you
to
feel
give
better.
her- You feel better.
I mean, what's the use of doing
So
all the
let's-
cosmetic stuff if you feel old and tired?
Correct.
True.
So energy goes up, mood goes up, depression goes down.
I was going to ask about that. A lot of people get depressed when they
From-
get older,
from-
and this helps that.
From low hormones,
Okay.
low thyroid, from cortisol, another hormone, which is your stress hormone, from lack of your growth hormone or insufficient levels. You will have symptoms while you're still normal, but less than 50 percentile of that normal, you start having symptoms for the most.
Oh, wow.
Okay? For the most. Not everybody,
Not everybody.
but for the most.
Okay.
So, like she says, she goes to the doctor, she has symptoms. You only had the uterus removed. You're fine. You must be depressed. You must
my
be
gosh.
crazy. You must, here, take this hyperstimulant to wake you up. Oh, but I can't sleep with that. Here, take a downer.
That's really sad.
With the parade
Wow.
of side effects. But that's a quick
Yeah.
fix.
Right.
That's rescue medicine. That is sickness medicine. You're sick,
Yeah.
you go to the doctor, he gives you something to keep you going.
Right.
It's a complete new field, advanced
Yeah.
preventive medicine, and help the body repair itself, regenerate, live healthier until you reach your expiration date. But you can even prolong the quality of your life.
We might have already passed it. Okay. Does insurance cover any of this? Or is it all private pay?
Well, think of it. I tell everybody, if I don't change the tires in my car because they're flat, the insurance company is not going to change them for me or give me an allowance for it.
Okay.
But if I have a car accident, they will pay for everything, including the tires. Okay? Insurances were designed to, so you don't become destitute in
Right.
the event of a catastrophe.
It's to say, yes, I
So
understand.
you became sick. They started, you're covered.
It's for catastrophic situations, not daily maintenance. Okay.
It is not preventive medicine. There's a big difference between advanced prevention
Right.
and early detection. Like going for a mammogram. They're looking to see if you already have it so they can pull it out.
Right.
That's early detection. Prevention starts when you're little, feeding you the right foods, reducing your exposure to environmental toxins, optimizing your vitamin D. Looking at your hormones when you turn a teen and you start with your hormonal imbalances and PMS and heavy bleeding. It's not about just giving you birth control pills to shut the symptoms up.
Right.
Okay? Sorry.
That's all right. No, I knew
It's,
people when I was young that had such bad cramps
That
they
was
couldn't.
me.
Yeah.
Those
Very
are hormonal
bad.
And so she
imbalances.
could have been treated at that point.
Very bad.
If we had the technology.
Right.
Remember,
It's
this
all
is
new.
new science.
Yeah.
Now, integrative holistic medicine is a new specialty in medicine approved by the Board of Medicines that regulates all the other specialties because they know we need to move forward and prevent chronic diseases in this country. People are dying from chronic diseases that started when that they could have prevented from when they were teens before they developed.
Wow. This is amazing. Side effects. Are there any side effects from the kind of treatment you're on?
Have you had any side effects?
No.
Good question.
Okay.
Semorelin injectable, well known in some people, can cause a histaminic reaction. Histamine, redness, a little rash,
Okay.
itchy.
Okay.
Okay, that's why people take antihistamines.
So if the injection doesn't work, you can do the
Exactly.
Okay.
Ipamorelin, which is a newer version,
Right.
they took that away from it. It doesn't do that.
Okay.
Some people with Semorelin can get headaches. Some people can not feel good. Some people's cortisol can go up.
Okay. What do you do if that happens?
We switch into Semorelin.
Okay. So between the two, one should work for most people.
It doesn't increase your cortisol. And there's another hormone called prolactin that doesn't affect your prolactin levels.
Okay.
So every 5 to 10 years, they're coming up with fixing what they found in the other ones, looking at other amino acids and combinations. But the goal here is to optimize your growth hormone, improve your body composition, help with memory, mood.
Oh, boy.
Erections, weight loss.
And I heard that you can build lean muscle much more easily if you're on these drugs than if you're not.
It improves the muscle, and it reduces fat. So that improves your body
Improves
composition.
muscle and reduces fat. This really does sound. Is it the fountain of youth? You think
It is part of the fountain of youth. It is a big part of it. Okay? I don't want you to think Tylenol, my headache goes away, I'm cured. No, it's not an antibiotic. Kills E. coli. No, it is. You have to take it.
it's a treatment?
It's a treatment. It's replenishing your growth hormone, and like she says, it took her 2 months to feel
You
it.
feel good.
A year later, she's doing it every other day.
So you just have to get
somebody overweight and sedentary. It might take a little bit longer. So,
Okay, is there any risk of being on the type of regimen she's on? Any negative, anything that could damage liver function,
Absolutely.
anything like that?
the risk comes from not monitoring the patient, not being monitored. That's why buying it from the internet, from China,
Right.
you're not getting that. Monitoring levels, balancing your other hormones, looking at what you're doing, what's going on. That's the key here.
Okay.
The ongoing support system from the healthcare system that we
Okay.
provide, from the physicians, from the patient advocates, from the lab testing we have, which is more sophisticated than plain lab
Wow.
test.
Okay.
That's what reduces risk of,
Having
for
a problem.
example, not side effects of testosterone, but having too much at a certain time and no one's paying attention.
Right.
We take care of our patients as if it was us and our family members.
Okay. So the monitoring is important.
Very important.
So if someone does this and is monitored medically, there's really no risk.
By qualified professionals that
Right.
know what they're doing
Right.
also. You know?
And now you had told me that it helps with heart health. Some people had asked me, I don't want. They said I wouldn't take that because I don't want to damage my heart. But it's the opposite, right?
Correct. We know of a movie star that became governor. Forgot his name. Not going there. Yeah. Nice
That
guy.
explains those muscles.
Huge muscles.
Yes.
And destroy
Right.
the heart.
He had to have valve replacement, right?
Yeah.
Okay.
So, yes, you can destroy your heart if you're doing illegal growth hormone that you got from who knows what source
Right.
that came from, who knows what country, that who knows how it was produced,
Mm-hmm.
how long has it been sitting in the garage, somebody's warehouse, so they can put it in their internet and sell it. You can do damage. You can do damage with thyroid.
I guess any medication that you weren't
can
taking
do-
as prescribed,
right,
and
because
okay.
you are overdosing and creating negative returns, basically. The
Right.
key here is not to overdose. We know how much to give patients.
Just the right amount.
We know to
And also, I read that with the Semorelin, you really can't overdose. But you're talking about the other additional,
Exactly.
like the pellets and the.
exactly.
Okay.
Exactly. We put a pellet in. A month later, we're checking levels
To see if you need. Okay.
to see what happened, how far it went, because we have, even though people are afraid of pellets because, oh, it's in me for 4 months, and how about if I don't?
Yeah. What if you had to take? Yeah.
Are you
what
going
if
to
you
check
had to
it
take
out if my levels are too high? No. We have other things we can do to bring the level down,
to bring it down? Okay.
let it wear off, and the next time we put a lower one.
Okay.
Okay?
Okay.
Not enough, we can add a second one.
Oh,
So it's
interesting.
easy. We have to.
So you can
You have to test.
You have to tweak it and get it exactly right.
And exactly, because everybody responds different. We have dosages that have been studied to be the right dose. We have to take it from there and individualize the care to the patient. We create the dose based on the patient's need.
On their labs. Okay.
Most conventional medicine drugs, you're either 50 milligrams, 100, or 200. So what they do, if they take everybody and they put you in those 3 drugs, 3 dosages, whether you're in between or not, they put you here or there. Sorry, that's it.
That's it. Wow. I want to ask you about sleep, because I have so many friends that complain that they can't sleep, and maybe that was happening to you before you were on. How is it now?
It's great. I sleep really good. I also take magnesium at night, vitamin, and did my DIM and my Semorelin, and it's great sleep I usually go to sleep around 10:30, and I wake up around 8:30.
And feel good when you wake up?
Amazing. My 8.5, 9 hours sleep. Yeah, I'm good.
Okay, we got to wrap
fabulous.
up here in a minute, but I want to thank both of you for coming. And it's the Bio Station.
Yes.
The Biostation in Delray.
Okay, and is there a website?
New one in
Where's the other one? Miami?
Miami.
Okay.
Yes.
And I know they're all over Facebook, Instagram, Twitter, because I've been posting on there all week. So very easy to find, and it's right on Federal Highway, right in Delray, sort of like right after you go over the Boca border, very close to Boca Raton.
Yes.
By Lindell.
In between
a little bit north of Lindell.
In between Linton and Yamato.
For those of you that live around here, it's on the west side of Federal Highway. So it's very easy to find. And boy, I might be running over there after what I learned.
You come in for a complete assessment.
That's
we
the
look
first
at
thing
your
you do?
blood.
Okay.
We do an exam, we go over your history, and we give you recommendations. But we also open your eyes
To what?
Look how diseases creep up in you.
Yeah, I know. And then
Don't wait till you
no.
have it.
I totally agree with you. Okay, thank you very much.
Quite welcome.
Dr. Lacayo, and thank you, Tanya.
Thank you for having us.
And this has been a lot of good information. Thank you. And I will see you next week. Okay, so now the next... You have been watching and listening to The Becky and Boca Show. Tune in every Thursday night at 6 p.m. to discover all the ways to spoil yourself and have a good time in beautiful Boca Raton. See you next week.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers